Dr. Kgosi, thank you so much for joining us here on the late edition. Perhaps let's start off with the sentiments in which was shared by President Cyril Ramaphosa yesterday at the United Nations General Assembly. Of course, we saw him there lauding, the National Health Insurance Bill. But at the same time, he does this where many concerns are still being raised around the NHI.
Well, I think as a concept, NHI is welcome. But as many have expressed concerns about how it is being rolled out, we cannot undermine our own history. The biggest problem in our health services is the division and the separation of the haves from the have-nots. So whatever plan is put on the table has to clearly articulate how that is going to be addressed. We have challenges in both the public and what we call the private healthcare system, which is basically the privatized healthcare system, which is highly dependent on medical aid. So we need to ensure that both systems are fixed from the beginning. There is nothing in the bill that speaks to the ills of the privatized healthcare system. We have a health market inquiry which was done a few years ago, whose recommendations are being ignored. So we need to begin to address both problems. We need to ensure that those that are on medical aid are properly and fully covered for the whole year, and they don't have shortfalls, and they are not dumped on the ailing public healthcare system when they run out of funds. And I think the biggest challenge is lack of consultation and not having every stakeholder at the table so that we have a plan that all of us support. We cannot come up with a political concept just because we have an election that is nearby. We have one chance to fix the healthcare system, and we should not use the term national in vain. When we use it, it should be we are reforming for everyone, and all of us are involved in that reform.
And Dr. Kgosi, we keep on hearing from those in the healthcare sector, especially also those attending the annual Hospital Association of South Africa conference, and they are saying that they believe that the NHI still needs to be amended. Do you share the same sentiments? Do you think that it still needs to be amended? And should it be amended, what still needs to be included in this bill?
As long as you are not addressing the issue of separateness, the issue of medical aids that are separate, and you put a line that says what we cover in NHI won't be covered by medical aids, that is totally insufficient. What needs to be done is to accept that we have enough money in the pot in South Africa. We're not going to ask for extra money, so that the people that talk about NHI not being affordable should be told that we are not asking for more money. We're just pulling the resources together and we are going to use them wisely. That would mean that the procurement system that we currently have in the public healthcare system should be dispensed with. We become a common buyer in terms of being able to negotiate national prices on which we're going to purchase goods. And the goods can still be purchased from a decentralized platform on the basis of the prices that we have negotiated nationally. At the same time that we do that, we need to amend the Medical Schemes Act to take it back to where you have a universal package in the Medical Schemes Act. All members are covered, clearly covered, no shortfalls, no payments, no out-of-pocket payments. What you then do is to ensure that this statutory fund is restored to what it was meant to do. As the HMI inquiry has recommended, you can't have a statutory fund which has no agreed statutory tariffs. That's what it is about, and that should be what medical aids are about. Outside that, then a private healthcare system can begin. The challenge is that you have privilege being protected, including parliamentarians. And because we are not being truthful about reversing apartheid in health, everybody's confused and everybody's concerned. We also have issues about the governance structures. Who appoints the people to the board? Are they going to be appointed by Parliament answering to the minister? Are they going to be appointed by the minister? We've just had a shambles in communications, where we have a board that is resigned, that is appointed by a minister. If that board was appointed by Parliament, the minister would make recommendations about their performance to Parliament, and Parliament would take the necessary actions. So there are strong issues around the proposed governance system. Let's be truthful. The Department of Health and National are not good stewards for the current health budgets that they handle. We have disaster after disaster in the public healthcare system. The private healthcare system is unaffordable. People that have medical aids get dumped when they are sick. You know, in medical aids, we always say, you're fully covered until you get sick. All these issues need to be addressed.
Yeah.
We have one chance to begin to address them, and none of these issues are being addressed by what is being proposed as NHI at this point in time.
And clearly, Dr. Letlape, there seems to be a number of problems when it comes to the NHI. At the same time, doctors keep on saying there needs to be a collaboration taking place between the private sector and the public sector. What would you say, needs to be looked into when it comes to collaboration here? And what's the best way to make this work so that, all South Africans can access healthcare?
What you need to do is to ensure that you have simple, proper, straightforward, clearly definable, transparent procurement mechanisms in the public sector. You need to keep wastage from both systems. So you can't make two systems collaborate without fixing the problems that are inherent in both of them. So this pie in the sky where people pretend like private health is working extremely well. The only thing about private health is that it's better than public health. And when you look at the number of dependents in the public healthcare system and the resources in the public healthcare system, pound for pound, it's remarkable that it is still standing, the public healthcare system. So there are ills on both sides. How do you get things that are not working to collaborate without coming up with a proper plan to fix the challenges in both systems? Yes, cooperation is needed. Yes, we need to get back to a system where all of us go private because, there's something wrong with our head. We like fashion. Not because we think there's better care out there. Remember, not so long ago, 2 decades ago, 3 decades ago, the best care was in the public sector. Let's bring that back. Let's ensure that those that work in the public sector get their own care from the public sector. Those that are public servants get their care from the public sector. Yeah. Those that are supposed to be full-time in the public sector should not be doing RWAPs, working in private, because that is what is destroying quality and care in the public healthcare system. Where people, the previous system created RWAPs, and the people that sit out there are blackmailing.
Yeah. And Dr. Letlape, it just brings me quickly to my last question before we close off this discussion. It is the issue around the NCOP, and we know that the deadline for the NHI public comment, it passed on Friday. What do you expect here? Do you expect that this will indeed be signed by the president and will be a law in South Africa? Or do you expect that if it is signed, that we'll still see a number of legal challenges because, many still believe that it is not ready yet?
I think this is not a sincere attempt that engages all South Africans with expertise on these matters to come up with a plan that is workable, that all of us will support. This is a political stunt, and because it's a political stunt and we're working on majoritarianism, it will be signed off. Then it will be challenged in the courts. There's still no clarity about, the powers, national powers, provincial powers. You have not amended the constitution to make it clear that you are now making health a national competence. And without that clarity and that amendment on the constitution, we are in a legal limbo.
All
So
right, then,
all
Dr.
I
Letlape,
see
thank you
with
so
the
much for your
NHI
time.
decline,
That is
the
indeed,
Parliament
unfortunately, I'm going to have to cut you there. We have run out of time. That is Dr. Kgosi Letlape. He is a health activist there, giving us his insights in terms of the NHI. Of course, on Friday was the last day for public comment, and of course, it will now be before the NCOP, and then it will then be taken to President Cyril Ramaphosa.